Okay, so what I want to discuss today is really, this was a study that I did looking at weanling to yearling films, and the reason we did it is there's so many, quite honestly, devastating things that can develop after a sale, and also some of the things we see on radiographs at a weanling sale improve. So I wanted to look at that to be able to give clients some idea of what their risk level is, and trying to help them to establish a value of the animal when they're looking at horses to purchase. So this first study was just on the Carpus and the Fetlock abnormalities, and it was presented at AAP in 2016 and by Dr. Katie Atwood. She was my intern at the time. So why do we look at the weanling or yearling sales? You know, they're often bought to resell, so we need to know really what improves and what doesn't. And that's not just for selling either. You know, obviously racing, people are buying horses at a very young age for racing as well. So this study was done between 2005 and 2012. And what we did was look at all the radiograph reports that I had interpreted for the weanling sales, and then we cross-referenced them for any entrance into a yearling sale. And then we looked at whether or not I had interpreted them at a yearling sale. So altogether, we had 722 horses that were in this study. So there's been a few previous studies that have been done. One was by my husband, Scott Pierce. He does, at the sales, we work as a team. He does the upper respiratory exams and the physicals, and I would do the radiographs and the ultrasounds. And so he looked at changes in the upper respiratory tracts from weanlings to yearlings. There was 371 horses in that study, and what we found is that they do change. You know, some of them mature, some get worse in particular conditions, but we were able to give people percentages. But the whole moral of the story is really that we need to be forgiving in younger horses, because a lot of them improve and change as they mature. And the other study that I had looked at for this paper was this one by Jacquet, and Jean-Marie Dunois was on this. And it was the evolution of radiological findings, and this was in 321 young horses. They had 3 different types. They had French trotters, thoroughbreds, and warm bloods. And they looked at 6 months and 18 months, so relatively similar. And they had 32% that were stable or unchanged from weanling to this yearling year, 38.7% that had new radiographic abnormalities, and then 46.6% of all the radiographic findings disappeared. And then particularly what was interesting is in the stifles, 85.7% of the osteochondral fragments of the stifle either disappeared or improved. So just want to discuss first something, this is a common finding in the weanlings. There's this flattening of the mid-sagittal ridge, or distal sagittal ridge. I always consider it mid, but I'm sure properly it's probably distal. And you can see the flattening on the left here, and let me get the... You can just see a little bit of flattening here, and then the very nice contour as a yearling. So, you know, how do these change and what happens is what we wanted to look at. Here's one a little bit more significant, where this has some moderate flattening here, but then you have this inflammation deep, or this subchondral lucency, and some, for me, that would be some initial inflammation, and then you go over here to the right, and you can see, well, maybe not, that it's starting to fill in, or the contour of the ridge, we're starting to see that. The inflammation deep has improved, and we're starting to develop what looks like a flap, but this is only 60 days. You know, a lot could change, and that may as well continue to ossify. So they typically improve with time. Here is a case where we had it 5 months. Honestly, when we did these films, we didn't have the, we now have some films that project better on when you're viewing them up on the screen. So the machines are the next machines, and the Eklunds that we had prior really don't project well. And so I just went and got some images to show you. These are not from the study. So here initially you see this very flattened, but you can also see just the very slight remnant of the OCD, or the flap, starting here. And then this is after 5 months. You can see that it has filled in as far as the contour of the ridge, but still have some change here. But to me, significant improvement. What's going to happen in another 5 months? So this is what we're looking at. So I made these categories, and they're very subjective, so which is why I'll probably never publish this, and EVJ would reject me. But we have a normal ridge, we have flattening, which was the first one that you saw, and then a mild lucency of the mid-sagittal ridge was number 2. Again, subjective. Next one's moderate lucency of the mid-sagittal ridge. I was the only interpreter on all of these films, so hopefully there's some consistency with me. My category 4 was mid-sagittal ridge lucency with that inflammation deep, and then 5 was a true mid-sagittal ridge OCD. So the prevalence as a weanling was 79% of them were normal. 99 had flattening, which was 14%. 37 had the mild lucency. 8 had a moderate lucency. 5 had the lucency with the inflammation. And 1 horse had a true flap on the radiographs. So when we looked at these, if you just look at, you have the different categories here on the left, and whether they increased, decreased, or were unchanged. And if you look here, obviously, and this is what we thought, that the majority of them do improve. Now, somebody say flattening might be worse than mid-sagittal ridge lucency. So again, little subjectivity in how these are. But over here on the right has the mean change. So if you look at that, this is the statistics to the study, but this shows you what the average change was in that group. And you can see all of them, except for obviously the zeros, were negative. So all of them decreased. And this is the number of categories that they decreased. So we do have some horses that develop these changes, but for the majority, the most of them do decrease with time. So the next thing that we looked at was Fetlock subchondral lucencies, or cysts. And this is one of those things from a sales perspective that if you have a subchondral lucency on your distal cannon bone, it doesn't matter how big it is. It only matters if it is not present. So when I looked at this, I didn't look at whether or not it improved. I just looked at whether or not it was completely resolved by the time of the yearling year. So in this study, out of the 722, 22 of these had these distal cannon bone lucencies. And so if you look here, here's the lucency this is as a weanling. Also has the mid-sagittal ridge lucency, and this is that same horse as a yearling at the yearling sale right here, where it has developed more of a focal and defined distal cannon bone lucency. So of these 22, 10 of them resolved. So 45% of these distal cannon bone lucencies completely resolved by their yearling year. So this can be a devastating finding on sales. So we wanted to know, it's not a great, if you tell somebody 50-50 whether or not it will improve or resolve, basically, that they can figure out what they're willing to spend. We also did this for the Pasterns, and it's interesting, it's very similar prevalence. We had 21 out of the 722, and of these, 10 of the 21 resolved completely, and that was 48%. So this is not from the study, this is just showing you the difference from weanling to yearling. So obviously this one is still present, but a little difference in how it looks. It's less sclerotic, it's more linear, which you might wonder on this, is this going to get bigger or worse? But here, as a yearling, some people would be fine with that, which I typically would. We did a study as far as these lesions in yearlings, and actually the central lucencies had some significance. So hard to tell people. I usually don't get very critical of those, but they, for the most, except 48% of them completely resolved. So the next thing that we looked at, and this is partly why I did this study, was for sesamoids and stifles. But the Sesamoiditis, to me, is the most challenging radiographic finding from weanling to yearling, because I just could not find good correlation. I might recommend to a client that, this horse has significant sesamoiditis as a weanling, and it sells really well as a yearling when somebody else purchased it. Or a horse that was completely normal developed sesamoiditis to a significant degree. And so it's a very frustrating finding, but I found it's more of a yearling, 2-year-old disease versus really a weanling disease. And so we put them into categories, and all these categories I made, and then my assistant went back and looked at them on the reports and add them to the categories. But I'm very specific when I'm writing reports in what I say. So it was very easy to put them into categories. So no proximal sesamoiditis was category 0. Slight change or just increased vascularity. I do write that down, even though to me increased vascularity is normal. But you wonder, is it going to develop into something more? If you look back at Joanne Hardy's paper from, it's probably in the 80s, where she was looking at it in standardbreds, there was some correlation with increased vascularity and suspensory desmitis in the standardbreds. So I do keep track of that. There were 10 horses in that category, or 1.4%, so small amount. Mild sesamoiditis was our largest category. There were 57 horses in that, which is, in this grading system, it was 1 enlarged canal. Mild to moderate, 1 to 2 enlarged canals. You might say, why do you have one that's in the middle? And the reason I do is because I find myself as weanlings, when you're trying to determine, what are you really calling that? I would have that sometimes, but actually going back on all these reports, I didn't have it. So that was my category 3. Category 4 was moderate or 2 enlarged canals, and then moderate to severe was 3 or more, because in our yearling study, 3 or more enlarged canals was significant in racing at 2 and at 3. So only 2 in that moderate area, none in the severe. So just to go over a few of these, and I'm hoping that you can see this. So here is a slight sesamoiditis to me. So you kind of have all these little canals that are, you just wonder, is that going to develop into more? And here it is as a yearling, which I would consider it completely normal. So you're trying to predict what's going to happen in the next year, and it's a little difficult. This is one that had the increased vascularity or slight sesamoiditis. This is as a weanling. We have these linear canals, but really the quality of the sesamoid doesn't look good when you look at the trabecular pattern in the bone. And I would be wondering, I might be a little bit concerned, even though it's only slight, but if we just look at the statistics as a yearling, these are fine. And indeed, this one as a yearling just has linear defects. I would consider that acceptable, the slide on the right, as a yearling. And it has normal linear vascular canals to me. And actually the quality of the sesamoid in that one is much improved as well. And then here's a case where you have one that really didn't change from weanling to yearling. You have this one enlarged canal here. This is not really well defined as a weanling. Gets a little bit more defined as a yearling into a linear canal, but still have the one enlarged canal there. So kind of a realm of what you can see. And when we looked at these, it's kind of all over the board. So there was no sesamoiditis that developed in 29 horses. And that seems like a high percentage of horses that have sesamoiditis, but I also include the slight in that category. So mean change was 0.69. Increased vascularity. So this is one I worried about a little bit. Do they develop into more sesamoiditis? And 60% did. 30% decreased, and 10% were unchanged. So, this very small group, they did increase. Mild sesamoiditis, the majority of them decreased, but only 61%. So not a strong relationship where you can say, oh, this is going to be fine as a yearling, because it still can be a concern. There were none in the mild to moderate category, and then in moderate, we had 1 increase and 1 unchanged. So if you look at the mean changes over on the right, you can see there's really not a consistent theme to that. So the next thing I looked at was what I call Palmar or Plantar sesamoid trauma. Obviously, these aren't very scientific wording. It's just how I know when I'm looking at something that's what's going on the sesamoid. What I'm looking at is kind of the lucency on the distal abaxial border on your oblique, where you have the concavity or a change in the contour on the abaxial surface of the sesamoid. And then when you look on the lateral view, it is that scalloped out appearance of the sesamoid. So it's along the back of the sesamoid where the annular ligament attaches versus along the portion of where the suspensory attaches. And it does look like it could be on the suspensory when you look at that oblique view, because there's a pretty significant lucent area where your suspensory attaches, or it looks that way, but actually it's just summation. So in these categories, I put normal and was 0. 1 was a change in the contour, so kind of that concavity with no sesamoiditis. 2 was the same with mild sesamoiditis. 3, mild to moderate sesamoiditis. And 4, moderate sesamoiditis. We didn't have any moderate sesamoiditises. And there wasn't a huge number in this group, but 17 horses had the contour change but no sesamoiditis. 10 had it with mild sesamoiditis, and 3 with the mild to moderate. So just to go over these, what we're seeing, so I mean, this is just a case of just 2 months in between, but this is what happens. So they avulse this piece of bone there at the annular ligament. You can see the parent bone starting to get inflamed, and that's because they're trying to heal that piece back. And when you look to the right here, this is at 60 days, they often look worse before they start getting better. And because of that, they take a very long time to really improve enough where people are comfortable with them at the sales. And the vast majority of these scan normal. Typically, if they don't scan normal, there's something else going on. So there's enlarged canals or whatnot associated with it as well. In my yearling study, these were not significant. They didn't affect performance. But here's another case, and this is 120, so 4 months in between. And you can see on the left, so here we have this kind of this concavity and the lucency, and it does improve, but that's a long time for it. You know, it's improved some. Some people were still going to be critical of that at the yearling sale. I don't think that's necessarily rightfully so, but can be an issue for reselling if you're going that route. So when we looked at these, similar to the mid-sagittal ridges, the vast majority of these improve. But we have 24 or 4% that did increase or develop this, which is not surprising because it is more of a traumatic lesion, and we continue to see these throughout the yearling year. And then if you look to the right for the mean change in these categories, they did statistically decrease, and those are the numbers. So another thing that seems to really affect people and their ability to resell an animal is carpal changes. So I wanted to look at the proximal intermediate carpal bone and osteophytes that develop there, and the distal radiocarpal bone, and I just put change because it can be lucent, it can be sclerotic, and you can have a spur, fragment, but you'll see we didn't have many of those. So proximal intermediate carpal bone spurring, we had a normal proximal intermediate, sharp. Mild spur is something that we would consider a spur. It was 1 millimeter. What we did was measure the normal contour of the bone, and then a moderate spur would be more than a millimeter. These are very subjective. I do try to measure them, and then I do grade them to some degree to tell clients. So, and this wasn't surprising with what we'll find here. So affected as weanlings, or there were 15 that were just sharp, 2 that had a mild spur, and again 2 with a moderate spur. And people, I think this wasn't surprising to me. I think it was surprising to some other people, but the reason I didn't feel, I wasn't overly surprised with it is we do see horses that have spurs as weanlings, and then they resolve as yearlings, which you don't typically think is the case. But if you think about it, the bone is developing into a larger bone at that time, and often foals are weak, back at the knee, things like that. And if those changes resolve over time, then they're not putting the stresses on there and developing these osteophytes. So wasn't surprising to see them mostly improve. However, here you have the group that had no osteophytes, and 7.3% of this population developed proximal intermediate carpal bone spurs. So distal radiocarpal bone, really the only changes I had, is just not something that we commonly see as Weanling, was the mild change in density on the distal radiocarpal bone. I still put these others down so that I could see maybe if we had them and then had them as yearlings. So it helped to grade them as yearlings as well. We only had 10 horses. And here's a change there, and not surprising, because I think, with distal radiocarpal bones, you have, it is more of a yearling type disease. I mean, we had 10% of these that didn't have any change develop. So 1 out of 10 horses are developing some kind of change on their distal radiocarpal bones. I think that's related to their weight and their conformation, because a lot changes from their weanling to their yearling year. But if you look at the percent change here, 30% of them increased, 30% of them decreased, 40% of them were unchanged. So if you have a client that's looking at a horse like that, there's really not, we unfortunately can't tell them, oh, it's going to be fine. It more than likely is going to be the same or worse. So the summary on the distal limb was the majority improved. The mid-sagittal ridge changes improved, sesamoid trauma improved, and the proximal intermediate carpal bone spurs. The varying responses were sesamoiditis and distal radiocarpal bone change. And then just to note that those subchondral lucencies or cysts, only about half of those in the Fetlock and Pastern completely resolved. So when I was given this talk I practiced this with one of my colleagues at home, and he's like, I really need to know what percentage developed, not what percent improved, because as you know, when you have a client buy a horse as young, you're getting slack in the spring when they radiograph them and there's something that wasn't there when you purchased them. So the mid-sagittal ridge changes, 4% of them developed some form of mid-sagittal ridge change. 29% developed some form of sesamoiditis. Sesamoid trauma was around the 4%. Proximal intercarpal bone spurs were 7.3%, and any distal radiocarpal bone change was 10%. This is our Saratoga practice. We have 3 practices: Lexington, Kentucky, Saratoga, New York, and Wellington, Florida. So this was the part of the study that I presented at AAP in 2016. And that was, I really wanted to focus on the stifles, because that seems to be such a concerning area for people. People don't want to buy them, and they don't want to buy them as foals. They don't want to buy them as yearlings. And unfortunately, we have a significant number that seem to develop them after their weanling sale as well. So really the relevance was, they're bought to either resell or race. And the consensus is that the abnormalities affect value, and they do. Weanlings tend to have a higher percentage of stifle osteochondrosis, and we want to determine the risk for our clients when they're looking at horses, and what can we tell them. So again, radiograph reports, we cross-referenced them, and this was all blinded. I didn't see the reports again. I didn't see the radiographs, because the radiographs, many of them were not root and riddle radiographs, and they were from the repository, so we had no way of evaluating them again. Of those, there were about 2,500 weanlings that we looked at the radiograph reports that yielded the 722, sorry. And then what we were looking at on the trochlear ridge and patellar OCD, or osteochondrosis, was we would measure them, much like I did in my yearling study, and it was a cumulative length of any different lucencies or fragments that we had. And I looked at those and measured on the lateral view and then the oblique view. And then for the medial femoral condyle, all of my changes were measured from the oblique view. And the reason is the CC view didn't come into play in the repository till several years ago. And so the majority of the study, I only had the oblique view, and that's where I'm comfortable measuring them. I feel like I can identify borders better. So just so you have an idea of where I was looking. So the categories for the femoropatellar changes were no change, less than or equal to 20 millimeters, lucency or osteochondrosis. 2 was 21 to 40 millimeter lucency or osteochondrosis. 3, more than 40 millimeter osteochondrosis. And then category 4 was actually the presence of a fragment or a true OCD. And then 5 was arthroscopic surgery. So these were the horses that typically would have had surgery from the time they were a weanling to a yearling. So you'd see this on the yearling report. So in the US, we have to announce any invasive joint surgery. So these will be present with the radiographs in the repository when we're reading them. So we would have record of it right with the films. So here was my category 1. The left is just the lesion and the right has the measurement. So this is less than 20 millimeters on the medial trochlear ridge here. Category 2 was at 21 to 40. This is what we might typically see, kind of a lucent area. And these are the more extensive ones. So this one was more than 40 millimeters on the lateral trochlear ridge. And this is our category 4, which was actually the presence of the fragment or true OCD. So then for the medial femoral condyle categories, and these gradings follow the yearling studies that we've done. And for the medial femoral condyles, I looked at grade 1 was a lucency less than or equal to 1.5 centimeters. So that's the length at the articular surface that we're measuring. And then 2 was a lucency more than 1.5 centimeters. 3, we added sclerosis. So sclerosis plus or minus a lucency, because sometimes you'll just see sclerosis in one of these condyles. What does that really mean? So that same lower measurement there. And then 4, sclerosis that was greater, and plus or minus lucency, because sometimes it is just sclerosis, greater than 1.5 centimeters. And 5 was actually the medial femoral condyle cyst. So category 1, I just want to go over the measurements here and kind of what they look like. This is a very mild change, no inflammation, no sclerosis. They don't even know it's there, it's just not ossified. So this was a lucency less than or equal to 1.5 centimeters at the articular surface. This is one of the longer lucency that are very quiet. Just seemed like the horse doesn't really know they're there, but again, long. Here's one that's very short, but has the sclerosis deep. So this was the category 3, the measurement at the articular surface less than 1.5 centimeters. And the category 4, I just want to show you what they look like on the CC view as well. But again, everything was measured from this oblique view. But you can see a significantly long lucency here and tremendous amount of sclerosis deep to this lesion. And then category 5 was the medial femoral condyle cyst. So initially, we looked at the left and right stifles separately because we wanted to concur that we could put them all together, because we didn't want to have one stifle that was a grade 4 and didn't improve, and one that was a grade 2 and improved, but that horse would have still been a grade 4, and vice versa. So we looked at it just as stifles as a whole. So the whole number were together, and then they were evaluated, and this was the statistics that we used. So for femoropatellar joint, you can see here that these are the ones that were normal. So about 14% of these stifles had some form of stifle osteochondrosis. And here's a percentage that increased as yearlings. When I gave this paper, I wasn't really thinking of this, but I should have went back and put it by horse, so you have a percentage of horse, which I don't have that information. But still 3.37 increased as yearlings. I think the reason why we think that they were so significant is because when you get these that develop after the sale, they're quite concerning OCDs. They're usually very large, and the horse is clinical, has a huge stifle. They're not typically your mild OCDs. So you can see, if you look at just your decreased area here, this is the percentages that decreased. Pretty good percentages of decreased in what we saw there. And again, this is the mean change. So if you look at your mean change, you can see basically the average that they did change. And I'll go through these individually on this, because to me the stifles are such a crucial part of what we're looking at in these foals. And so of the 197 stifles that were involved, 119 of them were category 1. So thankfully they're these small lesions. 106 of them resolved, or 89% gone. 5 were unchanged, 1 increased to a category 3 and then also category 4, and 6 of these, or 5%, required surgery. So pretty good risk that these will be okay. Category 2 was 42 of 197, and which was 21%. 78.6% of these completely resolved. 2 decreased to category 1, 1 was unchanged, and 6 of them, or 14%, required arthroscopy. Category 3, there were only 4 horses, and that's a pretty big lesion to have as a weanling, but of those, half of them did resolve. 1 increased to a category 4, which is basically an OCD, so you can kind of put those two together because the next one did require arthroscopy. Probably the other one should have had arthroscopy as well because there was a fragment. And then this was interesting and was the presence of a fragment or an OCD, and 32 of the 197 stifles were in this category. And what I found interesting was that 50% of them resolved. And part of the reason I wanted to do this study is because I remember years ago sending a horse into surgery after the Weanling sale, and because it had an OCD and it had a fragment and actually was clinical, and then they didn't send it in for another month, and by the time they had radiographed it when it came in, the OCD was gone. And I don't think Dr. Bramlage believed me that there really was a fragment on those sales films. So I was actually glad to see this. And we had some decrease to category 1 and 2. 9% remained in category 4, had the fragment, just people didn't opt to do surgery, and 34% required arthroscopy. So if you put those together, it's over 40% that did have an osteochondral fragment as a yearling or had it removed. And then the results for the medial femoral condyle. This is a less common lesion, but indeed one that people are very scared of because they're very hard to sell as yearlings. And if these were the normal stifles, so if you look at that, only, it's just over 5% that actually had the medial femoral condyle changes. If you look at the ones that increased or developed, it wasn't as many as you might think, just 1.6% of these stifles. And if you look at your decreased as yearlings, you have 50, 60, 60%, but they might just be decreasing a grade, and does that really make them acceptable as yearlings? And not necessarily, so not quite as stunning results as the OCDs. And then here are our mean changes of groups for you to evaluate. So I'm just going to go through these on what happened in each group. Category 1, so this is the smaller lucency. Majority of them are this. 48 of the 76 or 63%. 33 or 69% completely resolved. There were 23% that was unchanged. And then you just have the little tag-alongs. We have some that increased to other categories, and then 2 actually developed into subchondral bone cysts. Category 2 is that lucency that's more than 1.5 centimeters. Not many, only 5, and 2 of them resolved, so less than 50%. 1 decreased, 1 unchanged, and then 1 actually became a medial femoral condyle cyst. So did the sclerosis make a difference? We had 16 of those, 21%, and a quarter of them resolved. So again, we have these decreasing levels of resolution. 37.5, the sclerosis resolved, so they decreased to a category 1, where it was just a lucency. 2 of them were unchanged. 3 increased to a category 4, or actually became larger and had sclerosis. And then 1 developed a cyst, which was 6%. And then the larger lesions that had the sclerosis, there were only 6, but here even less resolve, 16.7%, or just 1 horse. 1 went to a category 1, which is just the lucency. 1 decreased in size, but still had the sclerosis. 2 stayed the same, and 1 developed into a cyst. And we only had 1 weanling that had a cyst, and it had a cyst as a yearling, so it had not changed. So anecdotally, both weanlings and yearlings with osteochondrosis or OCD or surgical resolution of an OCD, even if we take care of it, in the femoropatellar joint, they're discounted. previous work that we have done when we look at horses that have had stifle arthroscopy, when you get to the larger OCDs, they have a decrease in performance. And so the risk of purchasing a femoropatellar osteochondrosis is low, because 73% of all of those completely resolved. And the risk in the population, if you purchase a weanling that had a fragment, it was 50%. On the medial femoral condyles, you know, anecdotally, we would say the weanling price is decreased with this lesion. Jeremy Whitman at a practice in Lexington showed that there was a decrease in sales price in these as a yearling. Medial femoral condyle lucencies alone, if there's no sclerosis, were more likely to resolve. When you put the addition of sclerosis into that, the resolution rate actually was less. So what developed as yearlings? Again, I wish I would have done this by horse, not stifles, but 3.37% of the stifles developed some kind of osteochondrosis or OCD, and the medial femoral condyle changes, 1.61% actually developed that change. There's limitations to this study. Like I said, it's a limited population. We're just looking at horses that were presented for public auction. We don't know how they were treated, except for the surgeries. And there's some subjectivity in measurement, and somebody might measure something different than I would, and these were all ones that I had performed. As well as, I think I've been criticized some for this because, you know, I think some people believe that, okay, if it went really bad, that horse wouldn't be resold as a yearling. But in the US, I think that's quite the opposite. So if something went really awry, they would put it in another sale and get rid of it. Because we have that with a repository there. When that horse goes through, if it gets a $1,000 bid, it's gone. It's no longer your horse. So that has been nice in that group. So overall, the weanling and yearling sales radiographs, like we said, the majority of those femoropatellar lesions resolve. Majority of small medial femoral condyle lucencies resolve, and the presence of sclerosis decreases the potential for resolution of the medial femoral condyle change. And that is my whole presentation. Do you have any questions?